Okay, so we were able to go over some of this stuff, especially because we did so much in MedSurg 1. I mean, with the thyroid, with hyper and hypothyroidism, which is going to be the majority of this stuff for farm. As you know, that's gonna, I don't know, you're gonna need all of this stuff, but the synthroid especially is gonna be a huge one that you're gonna see. Some of you that end up working in surgery and dealing with the hyperthyroidism, you'll be seeing the patients that then go hypo, like we kind of talked about. So we're going to go through this again just because we didn't get to do it very well. But I am going to kind of skip through some of this stuff because we already did cover it and you guys were there for that. So, or for the most part. If for some reason you were not and going through this, I can answer individual questions on that, but I will cover the things that are important to know in this screencast. So if you don't know what hypothyroidism and didn't learn it the other day, make sure you go over it again because all of you have access to the books and are able to read that. But remember that the hypothyroidism means a person is not making enough of is not having enough thyroid hormone secretion, and that's what's in charge of metabolism. So remember, with the hypothyroidism, the patient's going to be sluggish, sleeping all the time, tired. Remember, they had the non-pitting edema. They would have a lot of weight gain. So all of that. Remember, there was also some links that you guys could follow. So levothyroxine sodium, the generic name Synthroid. This is the drug of choice for replacement therapy for treatment of hypothyroidism, okay? This is the main one that they use for patients with hypothyroidism. It ends up increasing the levels of T3 and T4. So when they do the laboratory test, what they will see is that the T3 and the T4 are low and the TSH will be high because the brain is trying to say, hey, make T3, make T4. Come on, thyroid, make T3, make T4 with that TSH signal. And so those levels end up high because the body's trying to get it made, and the T3 and T4 are low because the body is not making it. It can also be used to treat simple goiters and chronic lymphatic thyroiditis, which is Hashimoto's disease. Make sure you follow this link, click it, and go read up on Hashimoto's. You got your actions and your contraindications. Obviously, look down here, hyperthyroidism. So remember how we were talking about what are some of the side effects of Synthroid, and it would be the symptoms of hyperthyroidism, which we discussed. So there's your interactions, some other things that I just included them for you, side effects. So there they are, the things that a person experiences with hyperthyroidism, okay? Remember, it's revving everything up. So if I've irritated the system and revved it up too much, what am I going to see? Notice you've got the hypertension. Remember the cardiovascular stuff that we saw. The nervousness and tremors and headache, diarrhea, nausea, all that stuff that we talked about. So with hyperthyroidism, remember that's also known as thyrotoxicosis. Graves' disease we talked about, which again you can click this link and go see it. All these are for you guys. I go and find these so you can learn more about this stuff and have the knowledge. So if it's on here, it's going to help you. That's the most common type of the hyperthyroidism. And then you have remember the weight loss and the heat intolerance, the sweating, remember the sweating at night, the exophthalamus, that's that bulging eyes. And then, so the treatment, remember, you have the surgical removal of the thyroid, either partially or all of it, which then is going to end up causing hypothyroidism in most, and then radioactive iodine therapy, which you can click here and read about that. And that's going to be the two main things that we're going to focus on with treatment for that. So here's some nursing interventions that we're going to want to do for the patient with thyroid conditions. Again, remember, we're talking about the metabolism of the body. Either it's going really fast or it's going really slow. And whatever I do to treat, whether it's really fast or really slow, is going to likely cause the opposite. So like I was saying, when we think about some of our conditions, what we use to treat it, the side effects will be what the opposite would be. So like with diabetes, that's high blood sugar. If I give insulin, I'm going to cause low blood sugar, potentially, as a side effect. So that way you can kind of keep those straight when you're thinking about, okay, what's a side effect for this? Well, what's the opposite of it? And then that can help you with that. So this stuff right here, you just want to read through. It's extra stuff that I threw on there. I'm not going to go into any of that extra stuff. So the parathyroid gland, so this regulates calcium levels in the blood. The parathyroid hormone agents treat hypoparathyroidism. This is what the drug typically you're going to see called calcitrol. It's a vitamin D analog that promotes calcium absorption from the GI tract and secretion of calcium from bone to the bloodstream. Okay, so calcitrol I've actually worked with quite often. You guys will also see it. This is a medication. Obviously, your Synthroid you're going to want to do. I know I said that in class. But calcitrol, this is another one that you're going to want to have done and know about it. So there's different causes of hyperparathyroidism. The treatment is synthetic calcitonin, so that's what we were just talking about. Make sure that you go through that. So we already talked about glucocorticoids and the medications for that. But what that is, you're going to see that's coming from the adrenal cortex, okay? So the adrenal glands are responsible for that typically. So if the adrenals have a hyposecretion, that can cause Addison's disease. You guys will want to look that up and look into Addison's disease, and I'm pretty sure I've put a link to it somewhere. And then you have mineral corticoids, which is aldosterone. The body secretes aldosterone. Or the body has that, and it goes with the renin-angiotensin system. You don't have to know a whole lot about that at this moment, but we will be coming back to this with further medications in the future. It also promotes sodium and water retention, so it's going to help, especially when we get into medications for blood pressure. We'll be discussing that sort of stuff. So prednisone, I know I already said in another one that you're definitely going to want that. So here's your action, your use, your interaction, side effects. Oh, there's that Addison's disease that I wanted you guys to look into so you know what it is. And then that's it for this one. I know we just didn't get through it, so I wanted to go over it. Let me know if you have any questions.